Children of drug-addicted mothers. What is addiction? Addiction. Addiction is a condition that results when a person ingests a substance, example alcohol, cocaine, nicotine, or engages in an activity, examples gambling, sex, shopping, that can be pleasurable, but the continued use or act of which becomes compulsive and interferes with ordinary life responsibilities, such as work, relationships, or health. Users may not be aware that their behavior is out of control and causing problems for themselves and others. The population I chose to research was school-aged children. This category correlates with two stages of Erikson's theory of psychosocial development, Stage 4 and Stage 5. Stage 4 is industry versus inferiority, ages 6 to 12 years old. During this stage, children need to be productive and have successful experiences. Children are busy learning and given opportunities to master various tasks. Children who are able to find ways to succeed are industrious. Those who experience repeated failures will develop feelings of inferiority, hampering chances of success in the future. During Stage 5, identity versus identity confusion is adolescence. Adolescents are exploring who they are and developing their sense of identity. They try out roles for the future and integrate these roles into their sense of self. Adolescents who have difficulty integrating their roles into their identity will experience confusion about who they are. Playing and learning will help a child to be successful and industrious. Many families interact with the use of substances. There is lack of parenting, poor home management, and lack of communication between the child and parent. This leaves little room for learning and playing. Many times these children are exposed to learning and playing only at school, but there is an increased risk of truancy for these children as well. They begin to develop feelings of inferiority, according to Erikson, due to lack of exposure to these experiences. Adolescence is a time of developing your sense of identity. At this age, they are trying out roles to develop a sense of identity. Many of these children will begin to abuse substances as well at this age. Forming their sense of identity is based on the experiences around them. If they observe their parents abusing substances, they may abuse substances as well. There are many risk factors for children of drug-addicted mothers. Many experience school difficulties, such as truancy, expulsion, suspensions, or even repeating a grade. They also experience legal problems, such as juvenile detention, arrest, or even parental arrest and incarcerations. More risk factors for children of drug-addicted mothers include substance abuse, child abuse, sexual abuse, behavior problems at home and school, mental health diagnoses, including attention deficit hyperactivity disorder, oppositional defiance disorder, conduct disorder, anxiety disorder, major depression, out-of-home placement, such as a group home, going into an adoptive home, or even foster care placement. In a study of children of substance abuse users, the life experiences of children of opiate addicts and methadone maintenance. It was found that children aged 3 to 7 of addict parents had a diminished capacity for school success or adequate social development. They related these problems to the lack of parental supervision and attention. Children of addicts 8 to 17 years old had more problem behaviors in school, including truancy. Substantially more of the children of addicts had been placed in foster or surrogate care at one time, up to 30% compared to the estimated 2.3% of American children who do not live with either parent. It was also shown that excessive punishment and abuse experiences in drug addicts in children's lives. Excessive punishment such as hitting the child harder than they had thought they should have, or hitting the child with a fist, hitting the child with something other than their hand, threatening the child with a weapon, or using a weapon with a child. The examples of the sexual abuse or the physical abuse were charges of neglect or abuse filed regarding the children, or their child being exposed to sexual abuse, or charges for sexual abuse filed regarding their child. In another study of the risk protective factors among addicted mothers' offspring, a replication study, the study focused on the analysis was to determine if studies using a similar design, assessments, and analytic methods would produce similar results. The major findings of it was a replication in 2 independently conducted studies of school-aged offspring of opiate and or cocaine-addicted mothers of the high rates of any psychiatric disorder, major depression, ODD, conduct disorder, ADHD, and substance abuse among offspring. Both studies also found high rates of comorbid alcohol abuse, depression, and multiple drugs of abuse in the addicted mothers. Comparison of gender-specific rates of disorders revealed an increase in the rates of ADHD in boys versus girls that was consistent between the studies. Luther and others found higher unadjusted rates of over-anxious disorder, ADHD, and ODD in Caucasian versus African American offspring. There are several interventions that could help to decrease the risk factors for children from drug-addicted mothers and homes. Group therapy using expressive techniques is one example, play therapy for the children, cognitive behavioral therapy, preventative parenting programs in-home and or rehabilitation, and support groups. And much of the research that I found, preventative programs was in all of the articles. If parents can get into rehab and learn parenting techniques as well that can transfer into the home at a young age, that would be the first step. I also found an article on group intervention for children of drug-addicted parents using expressive techniques. In this study, 2 specialists met once a week for 18 months with children aged 8 to 11 years old. They used the model that was compatible with views of Erikson with regards to the ages of 8 to 11 as an age in which the child begins to develop a sense of control and activism. Activity in the group is an expressive form of therapy. The goal is to elaborate expressions of fantasy and conflict through play, storytelling, painting, and other artwork. The unique contribution of this article lies in the demonstration of the use of expressive group therapy and particularly of nonverbal techniques with children of addictive parents, with examples stemming from the topics dealt with by the group. Each week, the 2 specialists would give the children a different topic to work on. The topics dealt within the group activities were identification and differentiation of a whole range of verbal expressions for feelings such as joy, happiness, anger, sadness, loneliness, and exploring additional modes of emotional expression. Another week, it was me and my place in the family and society. The 3rd week, they dealt with the secret of addiction, such as my dad is an addict and the feelings it generates. The 4th week, they dealt with me and my friends, learning to make friends, which was problematic for some of the children since their interactions with other children were typically tinged with violence. The last week, they ended with the termination of the group intervention. Many weeks, they would work on activities with art, such as drawing a picture. One week, they did a whale and a little fish, and it was interesting to look at the pictures that they drew to show how they were feeling about addiction. And what they found at the end was that many of the children were feeling less lonely, and they were feeling that they now had friends and people that they could confide in. The nonverbal techniques used throughout the work with these children constitute an important means of therapy through expression, expressing emotions, reducing violence, and so on. It became clear that the work of the group helped the children to use a range of verbal expressions to make friends and to talk about the secret of addiction. They also felt that they could talk to their parents at the end of the session. At the end, I'm going to show a short clip of other interventions that can be used dealing with several of the risk factors that we discussed. It focuses on the trauma of substance abuse, also the child abuse or neglect. So next I'm going to show a video. Here are some important facts to remember about children of drug-addicted mothers. Children of addicted parents are more at risk of drug abuse than other children. Family interaction is defined by substance abuse. There is a strong correlation between parental addiction and child abuse. Children of drug-addicted homes are at risk for out-of-home placement. Children of addicted parents exhibit symptoms of depression and anxiety more than other children. Children of addicted homes are at greater risk of physical and mental health problems. Children from addicted homes benefit from supportive adult efforts help. I thank you very much for listening to my presentation.